Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 46 of the podcast. Today is November 16th, and I'm excited for today's episode because I invited a special guest to join us, and we're going to be talking about family medicine coding. So before we dive into our topic, it's time for your Monday dose of positivity, the Mindset Monday tip, and it's brought to you by Contempo Coding, which is an on-demand educational resource provider created for coders by coders. They specialize in affordable coding certification prep courses to help you accelerate in your career. Right now, they're offering an exclusive special to Alpha Coding Podcast listeners, and that's $125 off the Certified Risk Adjustment Coding Prep course, as well as some great bonus content when you order through our affiliate website. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of this absolute steal of a deal. So our Mindset Monday tip is all about letting go of worry. The quote I want to share with you says, "If it's out of your hands, then it deserves freedom from your mind too." I think we all need this reminder because it's really easy to get caught up in the cycle of worrying and stressing about things that we have zero control over. So much of what happens to us in life is completely out of our own control. So it's important that we remind ourselves of what we can control, and that's our reaction to the situation. And that kind of gives you some peace of mind when you get into that cycle of worrying and stressing about things that you literally have no control over. So if you find yourself in this cycle of worrying and stressing about things that you can't change, let it be and focus on what you can control, which is your reaction. So our guest for today is Sarah Ragan, and she's a local Florida friend and family medicine coder. Sarah's the president of the Daytona, Florida AAPC Chapter. She's also a coding instructor at Daytona College and is going to be sharing some great tips with us on family medicine coding. So thank you for joining us today, Sarah.
Thank you, Toni. It's really fun being here today.
Awesome. So give our audience an overview of what your everyday life looks like with family medicine.
Well, first of all, let me just say how much I really love coding family medicine. And the reason for that is that I don't ever get bored. Tend to see a lot of the same things, but there's always something new. I like it because I get to use my entire ICD-10 diagnosis code book. I'm not regulated to one small area. I am all over the place. So I feel like it gives me a very broad experience of using my coding education. Another thing that I really love is that I have both young and older patients. I get to see both male and female patients. I get to read about acute and chronic conditions. Every body part is in there. I feel like I have my toes dipped into the whole ocean instead of just the lake.
So evaluation and management services are the bulk of family medicine. What are the main components that go into determining code selection for an office visit?
Oh my gosh. First of all, let me tell you, when I first started off coding, E&M was my nemesis. And whenever I'm on like one of the AAPC Facebook pages, just anything where people are talking about coding, E&M comes up every time, and it seems to be universally hated. I have to even admit that when I took my CPC exam, I didn't do that great on E&M because, you can look up and see how you did in certain areas, and E&M was not my strongest. So I find it kind of hilarious that that is the bulk of what I do all day now. I can tell you right now that I have been exclusively coding family practice for the past 4 years, and I still use my beat up E&M template. I use it every single day. I had an E&M template. I had it laminated, and so I use dry erase markers and I spray it clean with my eyeglass cleaner every night. I don't trust myself mentally to do it without my E&M template because it's so easy to forget certain things when you're reading so many documents per day. So I still, to this very day, depend on it. If I have a meeting, I bring it with me. I love it. So it's going to be very difficult for me once the new CPT code changes come up because I have loved my E&M template for so long and I'm almost a little sad to see it go. But one thing I do have to say is I'm always looking for MDM or time. I love it when my providers actually give me the time on their documents to let me know how much time they spent with a patient because it certainly cuts down on the amount of box ticking that I end up doing. But of course, medical decision making is always going to be a key factor that I look at. that.
Yes, medical decision making is absolutely critical. Any other components that you think are important to highlight?
I would definitely say one of the things that I'm always looking for are vaccines. Sometimes they're kind of just snuck in there somewhere. I do love it when my providers use a template and put it in the same spot every time, but that doesn't always happen for me. So I'm always looking to see if, especially this time of year too, was a flu vaccine administered, was a pneumococcal vaccine administered. It's just something that I always look for. And also things like EKGs, I'm always looking for those as well, especially if we have a pre-op exam that day.
Sure. We've seen it all. Office visits without a documented chief complaint. Can you talk to our listeners about what qualifies as a compliant chief complaint?
All right. So I think we've all been taught that a chief complaint is the reason why the patient is there that day. And it's supposed to be in the patient's own words. I mean, we're both in the medical field. Have you ever called your doctor and said, I am coming in for a 3-month follow-up for my 4 chronic conditions? No, none of us talk that way. I already know that that's more than likely not the real chief complaint. Even when we're in this field, we're going to call in and say something like, my meds are making me feel weird, or I have a rash on my arm, or my left ear is hurting again. Most people do not call offices and speak in medical speak, if that makes any sense.
Yes, it definitely does. And one of the things I really like is when the providers put the chief complaint in quotations. It's literally the patient's own words. Medicare likes to keep things interesting for us coding professionals. We've got G codes galore. Give our listeners some pro tips for navigating Medicare only codes. And how does this pertain to Medicare Advantage?
Well, let me tell you, I am a huge fan of a cheat sheet. I do use my HCPCS book, of course, which is where your G codes are going to be located. So when I first started family practice, the woman who trained me gave me a cheat sheet. And now most of them I've pretty much committed to memory because I use them on a daily basis. So I don't need to use that cheat sheet anymore. But of course, have your books available to you at all times, and always sort of be on the lookout when you know that you're working with a Medicare patient. If you see anything extra being coded, there's a pretty good chance that there is a special G code just for that. And it's one of those things, I tell my students this all the time, is that it just takes time and practice. At first, you're not going to see these things, but eventually it'll be second nature to look for them. As far as Medicare Advantage plans, to me, it's really just keeping up with the names of the plans. If you don't know that it's a Medicare Advantage plan, you're probably going to give it a commercial code. If you're not familiar with the names, it's just going to happen. It'll be accidentally billed using a commercial code instead. One of the things I'd recommend here is to check all of your 65 and older patients. Have your front desk ask every time if there's been a change. I think sometimes our patients believe that we magically know that they've made changes to their insurance plans or their policies, and I'm not sure if I want that kind of power, but we just don't know. So if a patient has changed from maybe Humana Gold and moved on to United Dual Care, there's really no way for us to know. Or maybe they went back to work full time, decided retirement wasn't right for them, and now they have a commercial insurance again. So it's really up to not only our patients, but our amazing front desk people to keep up on our patients and make sure that the insurance is updated every single time they come in.
A big issue in family medicine, as I'm sure you're aware, is navigating same-day procedures, same-day well visits with office visits. Talk to us about how this works and kind of what you look for to determine what's codable.
All right. So, some of our patients, and you can tell by their chief complaint if it's done correctly, they'll let us know that a procedure is more than likely going to be done. For example, if you have a patient saying, my left ear is clogged, it's been clogged before, I've needed an ear lavage before, I'm pretty sure I'm going to need another ear lavage. Sometimes we know in advance, the provider will decide that very moment, like, oh, this patient is going to need maybe an incision and drainage, or maybe they'll see that the patient has, a plantar wart and decide to go ahead and cryo that thing off right there on the spot instead of referring them to podiatry. It does happen. And as long as these things are documented properly by the provider and that they have a corresponding diagnosis to support the extra code, then I'm going to go ahead and code it because, they did the work and they deserve to be paid for the work that they do. However, I also need to make sure that these things are showing up in the exam properly. So, for example, if I have a patient that comes in and the next thing I know, an ear lavage is being done, I I need to know, was this done with or without instrumentation? Was it right, left, bilateral? And then if I go to the exam and you're telling me now that the exams, it says ears are normal, then I'm going to start wondering, did this really happen? Or was this an accidental copy and paste from a previous document? That's when I'm going to actually have to query my provider and ask them for assistance in making sure that the document is legal and able to be billed properly.
Yes, and physicians love queries. So
I was going to say, I really try my hardest not to query my providers as much as possible. So that way, when they do get one from me, they know it's serious, because I really try not to bug them.
yeah, it starts with really proactive education and developing relationships and really getting to know their documentation practices.
Mm-hmm.
What are your top 3 pro tips for mastering family medicine coding?
The first thing I would say is do not attempt to memorize codes. You really need to know how to use your books. Get comfortable with them, especially with family practice, because you will use the entire ICD-10 manual, plus of course using your CPT codes and your HCPCS picks for those Medicare guidelines. We are all over everything except for the perinatal. I have never used a P code while I've been doing family practice, but I do say always, it's really better to know your guidelines and be comfortable using your books rather than memorizing things. The next thing I would say is, if possible, create a good working relationship with your providers, emailing them, querying them responsibly, being respectful, and being able to answer their questions, because I want them to trust me to help them. And then the last thing I would say is to be as up to date on your education as possible. Make sure that you're attending your local chapter meetings. Remember that you can also attend right now within 100-mile and get your CEUs, and that's so great. They're doing this because of COVID, and as much as I'm not a fan of COVID, I have to admit it has opened up my eyes to what all of the other chapters in our area are doing and how busy they are and how hard they're working to serve their members. And it's really been a great way to meet other people. I've very much been enjoying attending as many AAPC meetings through Zoom and through other platforms as possible. And then this way, it's easier than ever to meet your CEU requirements, and you get to learn from more people than ever before, and networking has been awesome.
Yes, definitely. I agree. This pandemic, obviously there's been a lot of bad, but there has been some good that's come out of it, and that's definitely one of them.
I think so too.
Yeah. So what's next for you, Sarah?
Well, next year I'm going to be the president of the Daytona Beach chapter again, so I'm very much looking forward to that. This year was so weird, having to constantly reschedule and cancel exams. It has been very, very hard on most chapters. And however, I really feel like we've really come out of it learning more about our members than ever before. So I've been very grateful for it. So if you're listening to me and you want to be a speaker in 2021, find me on LinkedIn, hit me up. I'd love to talk to you. The other thing that I was hoping to do was putting together a seminar. We didn't get to do a seminar this year, unfortunately. And, depending on how this pandemic continues, I would love to do an in-person seminar. Honestly, I didn't think I would miss people as much as I do, but I miss meeting in person and I miss seeing all of our members. And so I'm very much hoping to do an in-person seminar. And then the last thing I have that I hope I can pull off is that I would like to write an article for Healthcare Business Monthly. I've not done that before, and I love to write, so I thought that this would be a great thing to add to my resume.
That's awesome, Sarah. You should definitely do that. I've had some articles published, and it's a really great platform to be able to share your knowledge. So thank you so much for joining us today, Sarah.
Well, thank you for having me. I appreciate that you took the time to ask me and that we got to do this today.
So we appreciate you joining us today, Sarah. Be sure to connect with Sarah Ragan on LinkedIn. So it's time for this week's coding pro tip, and it's brought to you by Project Resume. When is the last time you had your resume updated? Your resume is literally your entry ticket to that next great opportunity. Project Resume will design a customized ATS-friendly resume to demonstrate your unique skills and experience. And even better, it's written by coders for coders. Make that investment in yourself today and visit projectresume.net and and mention my code ALPHACODING for special pricing. If you have a coding related question and would like to be featured in one of our coding pro tips, please reach out to me on LinkedIn, Facebook, Instagram, or YouTube. So this week's coding pro tip comes to us from Kansas. Hi, Toni. I work in an orthopedic clinic and have been coding ortho and spine for over 5 years. I recently started diving into more physical therapy coding, and it seems so different than what I'm used to in the ortho world. What are your best tips for someone new to PT coding? So this is a good question, and this comes up a lot, especially as folks make transitions within multi-specialty groups. So the main thing with PT coding is going to be the service-based CPT codes versus the time-based CPT codes. So for the service-based codes, you want to make sure that all of the criteria for that individual CPT code is documented and met. So for time-based PT services, it's important to be aware of the rule of 8. So if there is a code that requires 15 minutes of exercises or therapy, that particular code would require a minimum of 8 minutes or more be documented in order to report that code altogether. So I would recommend going on the APTA, which is the American Physical Therapy Association website. They have some great resources. You can take a look at the most utilized codes in PT, kind of work your way down the list. Of course, your CPT book and the guidelines. And then if you're working with different payers, you'll definitely want to check out all the different payer policies. So I hope that points you in the right direction. Please remember to hit that subscribe button now so you never miss another episode. Also, be sure to drop us a rating and review on iTunes. We really appreciate your support. So this concludes today's episode. Until next week, thank you for listening to the Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.